Doing YouTube, Nick Patap here from Next Gen Rehabilitation, and in today's video I'm going to be talking to you about strength training. All right, strength training in general, and then a little bit of strength training regarding some cardiovascular patients. So strength training, definitely a necessary piece of fitness that we do need to incorporate in our training regime. Not only do we increase muscle mass, joint integrity, but we also help reduce bone mass loss, bone density loss rather, and we improve the longevity of our joints and our bones in general, right? We increase bone mineral density, we slow down the process of muscular and bone breakdown. We're able to be more mobile because when we grow older, no one wants to be really bedridden and sitting in a chair and using a wheelchair or a walker. We want to keep strong legs, strong back muscles, strong glute muscles, strong upper body, so we can stay functional as long as we're capable of, right? And it's as independent as we can be and not rely on other individuals to help assist us. Now, the resistance training program, I get asked this all the time. Is it okay for me to do it every day? Should I be doing it every day? If you're someone coming from a chronic disease population and you have no background in resistance training, I would suggest to start with at least 1 day a week. All right, start with 1 day a week. And again, there's a lot of specifics that we can go into here, but talk to your exercise physiologist or specialist, physiotherapist, kinesiologist, whoever you're working with. But primarily with the prescriptions, we like to focus on anywhere from 8 to 12 exercises in a session. And these exercises target the big muscles, so the main musculature of the human body. And what that's going to allow you to do is target the big muscles to get the most bang for your buck, to help with posture, testosterone release, bone mineral density, again, strength in general. And it's just through research studies we found that by doing resistance training, longevity in bone and joint health is increased exponentially. So we want to be doing anywhere from 8 to 12 exercises. Starting out, you want to be doing 1 set. And rep range, it depends. If you're someone starting out and we're just getting going, I like hitting that 12 to 15, even up to 20 repetitions sometimes, just to get the joint going, get the muscle moving, and to understand what that muscular contraction should feel like. Do that for a couple weeks. Once you feel comfortable with that, then we can start bringing it down to the hypertrophy or muscle growth range, which is anywhere between 8 to 12 repetitions. Usually for the chronic disease population, I don't like going below 10. I feel that if you want to build muscle mass and if you want to build a little bit more strength, 10 to 12 is good. If you want to work on the endurance and just going through the motions, keeping the joint healthy, anywhere between 15 and 20 repetitions is good. Now, you don't want to be doing resistance training every single day. You want to allow yourself that day in between resistance training sessions to allow the body to recover. So, for example, a good exercise plan would be to exercise or to do resistance training on Mondays, and then Wednesday, and then take the rest of the week off, come back the week after, Monday, Wednesday. Once you start feeling comfortable and your body's able to recover, Monday, Wednesday, Friday. Okay, so this is just strictly speaking about resistance training. Cardio-wise, ideally we want you to do cardio most days, if not every day of the week. The body does recover a lot faster with cardio, but the thing about resistance training is we're breaking down muscle mass, muscle tissue, and we need that time to rebuild it to come back stronger and more efficient, right? So there is that period where the body needs to recover its own tissues, and if we go and start doing resistance training on the same muscles again the next day, it doesn't have a sufficient amount of time to recover, and what you're going to end up happening is you're going to feel sluggish, you're going to feel tired, you're going to have a lot of muscle pain throughout the week. There's good muscle pain, which should last anywhere from 1 to 3 days. You should never be bedridden by muscle pain. I mean, you wake up in the morning, you get out of bed, you feel a little bit stiff, that's fine. With tight muscles. But if you're someone that wakes up in the morning and you can barely get out of bed, your exercise session was probably too hard, or you're not getting sufficient amount of rest. All right, and that's something you can talk to your exercise physiologist or kinesiologist about. So hopefully that video helped out. Again, the biggest points there are focusing on the major muscle groups, starting with 1 set of 12 to 15 repetitions, and then working your way up to 2-3 sets. Once you feel you're a little bit more advanced, if you are working your way up to 2 to 3 sets, you want to be taking at least 1 minute of break in between, and eventually moving on, to doing resistance training, from 1 day a week to 2 days a week, and potentially up to 3 or 4 days a week. All right, so hopefully you enjoyed that video, and we'll see you in the next one.